So crowns and bridges have been basically a procedure that has been done for many, many years in dentistry. The very nice thing about what we've done in terms of technology is we've allowed that procedure to be much easier from the standpoint of, start to finish, getting the restoration completed. And so basically what a crown is that, we do, many patients understand what fillings are, so you're just sort of filling inside of a tooth, but a crown actually covers the top of the tooth. And so what a crown is meant to do is protect the tooth from bite forces, and actually it shields the tooth from decay, but it basically helps protect the tooth for many, many years. And it looks like a tooth, flosses like a tooth, chews like a tooth, and for many patients, they can maintain these restorations for 20, 30 years if they're maintained appropriately. So I think it's a nice benefit that we can provide a patient, who's maybe had a lot of restorations in one area of their mouth, and so sometimes you can sort of start that crown process for that patient and help protect their teeth. And many times we're actually doing crowns in an emergency approach. Obviously, we'd much rather perform a crown procedure in a preventative approach. However, many patients, they'll have a problem and we need to go ahead and protect the tooth. Unfortunately, more oftentimes than not, we can do that and not have to commit to doing things like root canals or whatever. So, but in the event a patient does lose a tooth, basically we get into the conversation of an implant versus a bridge. With a bridge, it's almost like getting, 3 or 4 or 5 crowns, except all those crowns are connected together, and essentially one of those or 2 of those may be simple replacements for that natural tooth. So basically it's connected to the adjacent teeth. So flossing is actually impossible between those. We have special types of brushes and special types of floss that clean under bridges, but it's certainly a procedure that helps patients with missing teeth and sometimes can be the better option versus, say, like an implant, if you really can look at all the considerations.